Hi, my name is Madison Bell. This is my information speech. Here's my audience today. Infertility has always been a huge interest of mine. I believe it is almost every woman's greatest fear to be infertile someday when they're having the chance to be pregnant. Senior year of high school, I was able to do a really cool experience where I got to intern at one of my favorite places nearby, the infertility clinic. This is where couples come in when they're struggling with getting pregnant and they're able to find a new chance of having a baby. So I got to experience a couple different things. Couples coming in for their consultations to the actual procedure in the operating room where eggs were being transplanted and received out of the women. IVF blows my mind. The technology and knowledge that we have accumulated over the years is extensive and amazing. 50 years ago, if you were not able to get pregnant, that was that. Now you can go in and a baby can be created under the microscope and implanted back into the uterus. It's mind-blowing. Today I want to share why couples use IVF, what the actual process entails, and share some risks and rewards that stem from it. So, why couples use IVF? The number one biggest reason, of course, is fertility issues. Infertility is a very common thing that many people are privileged to not have to think about. In an article called Infertility, the Impact of Stress and Mental Health by psychiatric.org, it says that 1 in 8 couples struggle with fertility, whether that be from the man or the woman. Infertility, although there are many options and solutions like IVF, is still very worrisome and a heavy subject that many have to struggle through. It comes with stress, anxiety, depression, and even grief in some cases. Psychotherapist Beth Jager-Skingen writes, "I believe that all people who struggle with infertility are experiencing and grieving parents. One thing that also comes with infertility is the use of medications in order to raise hormone levels. These increase egg and sperm count in the beginning of your process of IVF, but they also can affect your mood and satisfaction in life, so that's a huge factor to think about before going into it." Another big reason why couples use IVF is avoiding genetic disorders. In an article titled "Genetic Disorders, What They Are, Types, Symptoms, and Causes" by Cleveland Clinic, it states that there are 3 types of common genetic disorders, which you can see on the screen here today. Your first type is chromosomal conditions. In most cases, the patient is missing or has an additive chromosome than the normal count. A common example of these may be Down syndrome or Turner syndrome. Complex disorders come from medications, alcohol use, diet, and other controllable factors that you have during your pregnancies. Some examples of these are diabetes, cancer, arthritis that are able to be changed before going in, which is why couples may go for the IVF. And finally, single gene, which comes from a mutation in a single gene. Some examples of this are deafness, sickle cell disorder, cystic fibrosis, and other things like that. Now that you can kind of understand why IVF is so important, let me explain how the process works actually going through it. So a step-by-step procedure according to the in vitro fertilization by Mayo Clinic was done. In the beginning of the process, you start with the ovarian stimulation of hormone therapy. This is what I was talking about, where you're injecting the actual hormones into the female. This helps your body to stimulate your ovaries so that you can produce a normal amount of eggs. This lasts about 1 to 2 weeks, not too tedious, but definitely a lot having to inject them yourself. Then you move into the egg retrieval stage. The egg retrieval stage where the female undergoes a transvaginal ultrasound aspiration, which is what you can kind of see here. So in order to reach the ovarian follicles up top past the uterus, you have to collect any eggs that may have been developed. This procedure only takes around 20 minutes and you can collect multiple eggs at one time. When it comes to the sperm retrieval, it can be done day of sight, like when the woman comes in to get her eggs retrieved, the man can produce the sperm, or the sperm can be frozen multiple days in advance. The next step in the IVF process is fertilization. This can be done 2 ways. The first is conventional insemination, when the sperm and eggs are mixed and observed in an incubator. That's the most common way for IVF to be done. But the second is intracytoplasmic sperm injection. This is conducted only when there is an issue when the sperm number or sperm production or past IVF conventional inseminations did not work. This is when the sperm is directly injected right into the egg cell underneath the microscope, so it's much more tedious. 2 to 6 days after the eggs have been collected, they can be implanted back into the uterus for a hopeful pregnancy. A catheter is placed into the vagina through the cervix and into the uterus, where then the eggs are placed through a small syringe at the end of the catheter. So this is kind of what you can see here. We'll have this long needle go all the way up into the uterus and implant the actual zygote, which is the egg and sperm together, back into the uterus. And these catheters actually have a very small camera on the end of them, which the doctors can look up on the screen and see where they're implanting the actual zygote, which is amazing. The small syringe at the end of the catheter then releases the embryos directly into the uterus once in position. After around 12-ish days, there will be a blood test for the female to see if the fertilization has worked and if the patient is pregnant or not. So although there are so many amazing things with IVF, there's definitely some risks and of course rewards that come with it, but I want to touch on some of the risks that we can see. Some of the most common with assisted fertility are multi-fetal gestations, which is just multiple pregnancies at once, which most females going into IVF are not looking for. They're looking for just one baby, but sometimes you might end up with 2 or 3. Prematurity, low birth weight, and C-sections are very common, other birth defects of course, but one of the most devastating things that can come from any pregnancy is a stillborn birth. Stillbirth is more frequent in pregnancies achieved through IVF, at the rate of 16.2 to every 1,000 babies compared to 2.3 with a normal pregnancy. So although IVF sounds like an amazing solution for couples troubled with infertility, there are many more factors to consider before getting into the IVF process. For example, age is a huge factor when it comes to this. The normal age range is around 24 to 34 years old. When past the 40-year range, your pregnancy chances drop drastically. Another factor to think about before trying IVF is if the patient has had past pregnancies that have failed. Why have they failed? Was it due to uterine abnormalities, fibroid tumors, or ovarian dysfunction are all things to think about, even in a normal pregnancy as well. A huge factor is also lifestyle choices. When patients are looking at going into IVF, the practitioner has to make sure that the client is fit for such a tedious process. Healthy diet is key. No drinking, no drugs, exercise, and healthy weight are all things that have to be thought about, even when doing a healthy pregnancy, of course, as well. And when it comes to rewards, it's simple. Creating a family when all odds are against you is amazing, and feelings of fulfillment, joy, and love for being able to bring new life onto this planet. Now that you kind of have a better understanding of what IVF is, the process, the risks, and the rewards, maybe someday you'll be able to share this information with someone in need or a couple that's looking it out. Or maybe today was just a chance to learn about something new. The technology with IVF is only growing from here on out, and it's just amazing. I cannot wait to see what we will be doing with assisted reproductive treatments 10 years from now. Hopefully, I will be a part of the process in the science. Thank you.